Good afternoon, everyone, and welcome to our Lessons in Dementia workshop on managing dementia-related behaviors. Today, I'll be discussing some of the most common dementia-related behaviors, possible behavioral triggers, and providing suggestions on how to approach these behaviors using non-pharmacological approaches. I'll be finishing today's workshop discussing risk of caregiver burnout and suggest some local resources available to aid families and care providers. And just as a reminder, if you have any questions, please feel free to place them in the chat box below, and I'll be answering them at the end of the workshop. Before we proceed, I want to start things off with a quote. Those with dementia are still people, and they still have stories, and they still have character, and they are all individuals, and they are all unique, and they just need to be interacted with on a human level. This quote from Carey Mulligan is a good reminder. Those with dementia are still the person you've always known and shouldn't be treated any differently because of their dementia diagnosis and impairments. Behaviors occur on a spectrum. At one end of the spectrum, you have behaviors that are not typically considered harmful and need little to no interventions. These behaviors may just require simple redirection or distraction. An example of a behavior that requires little to no intervention is repetition. While at the other end of the spectrum, we have behaviors that have a negative effect on an individual's quality of life and require more investigation to identify the trigger of the behavior and the intervention that is needed. For example, hallucinations are a behavior that may require more intervention and investigation. As dementia progresses, many people may experience behavioral changes in addition to memory loss and other cognitive changes. These behavioral changes may be due to underlying medical conditions or environmental influences, which I will be talking about later on in this workshop. It is often these behaviors are used by the individual with dementia as a form of communication to notify us that something is wrong, missing, such as hunger, loneliness, pain, or the need to rest. And it is our job as care providers to decipher what behavior is trying to tell us. These are the behaviors I will be discussing today. When assessing behaviors, there are a few factors we want to look to investigate what might be triggering the behavior. The first factor to look at is the behavior being presented and how it is different from the individual's baseline. The second factor is, have there been any notable changes in the person's environment, their health, routine, etc. Lastly, you'll want to take your answers to these questions and write them down in a logbook or journal and discuss what steps you took to address the behavior. By creating this log, you have something to reflect on if the behaviors were to continue, and you would have a starting point of where to address the behavior in the future. Another method for assessing behaviors is DICE, which is a tool created by the University of California, San Francisco, which is a 4-step process focusing on the patient, the caregiver, and environmental perspectives. DICE stands for describe what happens, investigate possible causes, create a plan, and evaluate the plan. And if you haven't, can you please mute yourself? Thank you. The first half of the tool has you question the behavior and analyze possible triggers, followed by your response to the behavior that is being presented. For a complete version of this tool, you can visit the link that is included on this slide. Agitation and aggression may be triggered by a variety of things, including environmental factors, fear, and fatigue. Most often, this behavior can stem from the loss of control and independence. Some ways to approach this behavior are to give the person space and time to calm down, avoid small spaces, be sure to empathize and apologize. I'm so sorry, this is so frustrating. Offer reassurance. I know this is difficult, but it is going to be okay. You can also reduce background noise such as TV, music, and other ongoing conversations. And remember that anger and fear responses naturally subside within seconds in the absence of continued triggers or repeated thoughts. Wandering is a common behavior that can occur in any stage of dementia, and it can be dangerous if not prevented. The most common triggers of wandering are trying to fulfill a need, such as hunger, thirst, or needing to use the restroom. The individual can also be trying to locate someone or something. They may also be confused by their environment and feel the need to go home or to work, even if they are no longer living in their home or working. Some things you can do to try to prevent wandering is to remove any items that may trigger the individual's desire to leave, such as keys, hats, purses, and coats. Offer opportunities of exercise during the day to prevent restlessness. Try to create a visual barrier to mask doors with a curtain or applying a stop or do not enter sign to the doorway. Offer activity or attempt to engage in a conversation. And determine if there is a pattern to wandering. Log this pattern. Identify the time of day the person is most likely to wander. For those experiencing sundowning, this may start early in the evening. Plan things to do during this time, such as activities and exercise that may help reduce anxiety, agitation, and restlessness. Hallucinations and delusions can occur in all types of dementia, but they are especially common in Lewy body and Parkinson's disease dementia. A person with dementia may be unable to put bits of information and memories together correctly, which can lead them to draw false conclusions and believe something that isn't true. Things you can do to address these behaviors are state simply and calmly your perception of the situation, but avoid arguing and trying to convince the person that their perceptions are wrong. Respond to fears expressed that must seem scary and focus on the individual's feelings. Keep the rooms well lit to decrease shadows and offer reassurance and a simple explanation if curtains move from circulating air or if a loud noise such as a plane or siren is heard. Distractions may help. Depending on the severity of the symptoms, though, you might consider medications. Remove the individual from low stimulation environments, And when the person is not bothered or distressed by their hallucinations or delusions, it is generally best to acknowledge their experience with a matter-of-fact tone, without denying nor endorsing it. Often those with dementia may become resistant to daily activities such as bathing, dressing, and eating. This can be a response to feeling out of control, rushed, afraid, or confused by what you are asking of them. Additionally, This resistance to care can also be attributed to an invasion of privacy or personal space. Some things you can do to address this behavior are to break each task into simple steps, and in a reassuring voice, explain the step before you do it. Provide the individual plenty of time, and and find ways to have them assist to their ability in the process, and follow with an activity that they can perform. Make sure the person is comfortable and that the space around them is calm, quiet, and well lit. Encouraging and promoting independence is an integral part of self-confidence for people with dementia. You can consider personal care a therapeutic intervention for dementia. Strive for the persons with dementia to remain as independent as possible. And if the person is resistant and uncooperative, stop and try again with a different approach. Often when you hear about individuals with dementia experiencing issues with sleep, you may hear the term sundowning. This term recognizes that a person's internal clock has been disrupted and their nights have become days, which can lead to an increase in behaviors. Some approaches to avoiding issues related to sleep are keeping a regular routine, encouraging exercise each day, limit naps, and make sure the person gets enough rest at night. Being overly tired can increase late afternoon and nighttime restlessness. Be sure to set a quiet, peaceful mood in the evening to help the person relax. Keep the lights low, try to reduce noise levels, and have relaxing activities. And be sure to avoid alcohol and products containing caffeine. Dementia can affect a person's inhibitions, which may mean they express private thoughts, feelings, and behaviors, including those related to sex, publicly. Some ways you can approach this behavior are: check the person for signs of physical need, such as needing to use the restroom or feeling cold or overheated. Be sure to be consistent with the person about what is okay and what is not okay. Try changing the topic of the conversation through redirection or distraction with an activity. If you think the person is seeking more physical affection or intimacy, consider pet therapy, a stuffed animal, and socially appropriate touching like hand-holding or dancing. In addition to individuals with dementia experiencing memory loss, their brain has been altered to process the information it receives differently, such as changes in a person's routine, how they express their discomfort, or how they respond to their environment. This information can be translated into a trigger for behavioral changes. And these are a few of the common triggers we will be discussing today. Daily routines help reduce stress and anxiety because they help everyone involved to know what to expect. Persons with dementia thrive on familiarity. Just like you and I, those with dementia benefit from having a routine and knowing what to expect. And when something about that routine changes, your day can be thrown off and mood affected. Ensuring that a routine is in place can help prevent agitation, restlessness, and other behaviors from occurring. Routines can also be beneficial to the caregiver, alleviating stress by providing the individual with dementia a sense of familiarity in their confusing world. Dementia alters how one responds to their environment. If the environment is noisy, the individual may have a difficult time following conversations, become easily distracted, and may become overstimulated. Here's an example of what could be an environmental trigger for those who experience hallucinations and how you might assess the behavior. Try observing the environment from the individual's perspective. Are there any visual or auditory cues that may be playing a role in these hallucinations? Are shadows being cast, triggering sounds or objects that could be mistaken by the individual with dementia? Other ways to respond to environmental triggers would be to go to a different room and be sure to minimize background noise, limit multiple people from talking at once, and if it's needed, take a break from talking. Behaviors are an attempt to communicate that something is missing or wrong, such as hunger, loneliness, pain, or the need to rest. We all have unmet wants and needs. People with dementia express their needs and wants either verbally, non-verbally, or behaviorally in ways that are not always understandable. Things you can do to be aware of unmet needs are to pay attention to the time of day or location of the action. Think about what is going on around them, such as too much noise or bright lights that may cause scary shadows. Think about the person's habits and what they like. This may give a clue about their needs and what might be causing their actions. As I mentioned earlier on, an individual with dementia may not be able to express feeling, pain, or not feeling well in a way that you or I might. As dementia progresses, facial expressions, body movements, or behaviors can become clues to pain. Verbal cues may be ouch, hurt, not right, or visual cues you can look for may be a grimace on their face, or covering, rubbing, or protecting a part of their body. Things you can do is to ask simple yes or no questions. Try gently touching the area of the body where you suspect pain while watching their reaction closely, and look out for behaviors such as agitation, becoming withdrawn and not participating in activities they enjoy, or changes in their sleeping or eating habits. Urinary tract infections are also very common with older adults, and behavioral changes can be the most common and often the only symptom of a UTI. Older adults may often experience an increased need to urinate and increased incontinence. However, any sudden change in behavior or sudden worsening confusion should be addressed. Things you can do to address and avoid UTIs from happening at home are offer at least 6 cups of fluid every day to prevent dehydration. Encourage them to use the bathroom frequently, about every 2 hours, and look for signs like pacing or increased urgency when they need to go. Communication is an important part of being able to express one's needs, and individuals with dementia may find it more difficult to express their needs. Some communication tips for those working with people with dementia are to apologize for your inability to understand, use simple and exact words, do not disagree or argue with made-up stories, respond to the person's feelings and not their words, use distractions, do not try to reason with the person, give yourself permission to alter the truth, avoid asking questions that rely on memory, break down all tasks into simple steps, respond calmly to anger, don't contradict, and maintain good nonverbal behavior. Make eye contact, touch, smile, and move slowly. We're going to watch a short video now where caregivers give their approach to their loved one's behaviors. For an example,
But at that time, I was really frustrated. That time was just, I guess, it was the beginning. We didn't really know how to talk to her, I guess. So I'm gonna sit here. She was kind of like fighting against me, yeah. And I was like, oh, gosh, I don't know what to do after that. We just left. And then we had to think of new ways to talk to her. And so we come up with this method of, okay, we're gonna talk to her like kids, like children. We're just gonna lie to her most of the time, but at least for me.
I wouldn't call it lying. I'll call it encouragement. Encouraging her in the right direction.
When I took improv, we learned how to accept what the other person said and then add to it. And those 5 nights of doing it, plus I think playing with my friends' children and playing with other children, it's the same as when you play with little children and you go into their little world and play along with it. It's the very same thing.
So I would say like things like, oh, you know, 沖涼啊，你沖涼你會好靚啊，你好多男人會打電話俾你啊，會帶你出街，會鍾意同你跳舞啊。So English, the translation is basically, oh, if you shower, all these men will line up and give you a phone call and take you out and wine and dine you and dance with you and things like that. She would, you know, at first maybe she wouldn't quite listen because she would be a little agitated, but eventually she would kind of carry on. Then she'll start to giggle and say, oh, you're crazy. And she would just start being bashful and thinking about all these guys calling her and stuff. So that would be a great way to just distract her. One example of getting her to do something that needs to be done, but in a fun way, and kind of distracting her from the caretaker that she didn't really like, from showering her. And yeah, that's just basically one technique, one type of strategy we would use.
You just have to always encourage her. You have to say things like, oh, you're doing a great job, excellent, wonderful, you know, just things that you would say to a child, actually. You know, you wouldn't say all these negative things to a child.
Yeah, instead of using words like no or you know, you're doing, you know, this is wrong or things like that, you have to say, oh, let's do it this way, or oh, you're doing really good, but let's do it this way instead, or oh, let's go over here. A lot of times she's like, oh, I want to go cook for my mom who's passed away. Mm-hmm. And then we're like, okay, let's go out. And then she's like, oh, you know, and then like, oh, let's see what's going on over here. And then she's like totally distracted. She totally forgot what she wanted to do. So she, you know, it's kind of redirecting what she wants to do, but in the other direction where she should be going. Yes. She would remember something from her past randomly. She's like, oh, I need to return something. I'm like, oh yeah, we did that yesterday. Don't you remember? We returned it already. So it's, instead of correcting her and saying, no, that's not true, yeah, you don't need to return it, it's like, oh, we did it already. And she's like, oh, okay. And then she lets it go.
We introduced new caretakers as your aunt. And since we have changed a few caretakers, you know, every time when there's a new one coming in, we would say, oh, this is, you know, our relative.
The caretaker has to also be willing to play along.
Right.
And kind of keep that facade. We would bring the caretaker along to some family outings and bring her to dinner. And one of the mistakes we did make, though, is that we didn't keep it up. So then she started to forget, and she's like, oh, she's not your aunt.
Oh, yes. Yeah, we have to
so
keep
it's
it up.
kind of, you have to kind of keep that act up and continue to remind her that she's the aunt, and continue to kind of periodically bring her out to family stuff.
Because trust me, rationalization, trying to teach her, trying to get her to cooperate, trying to guilt her, trying to make her have sympathy for us. Will not work.
Does not work.
I learned very early on that you can't reason with somebody who has Alzheimer's. And it was difficult to learn all the ramifications of that very simple sentence, but it is very true.
To continue along with some other communication suggestions, we look at saying the word okay as a way to diffuse a situation. When we say okay, all we are doing is acknowledging that someone spoke and we heard them. We are not necessarily agreeing with them. When we say okay with a pleasant tone and positive look on our face, we can diffuse the situation rather than argue. Even if they're accusing us of doing something we didn't do, we say okay. And when okay doesn't work, then we will fix it with a therapeutic fib or story. By going to the individual's world and accepting their truth and not arguing with them. When using therapeutic fibs or stories, you need to remember that you are not intending to deceive your loved one, but rather you are simply helping them feel more comfortable and they are in a more agreeable and safe place. The primary goal is always comfort and to spare them from unnecessary upset. Look at it as an act of kindness rather than deception. An example of a therapeutic fib would be a story about Marie. Marie recently moved to a new community and wanted to go to her home in Spokane, which she had sold many years ago. All day she continued, "Is anyone going to Spokane? I will pay you to go to Spokane." Distraction was not working well, and Marie was becoming agitated and not wanting to eat dinner. Finally, when staff members said, "I think I can take you tomorrow, but let's have dinner tonight," Marie said, "Great, but I don't have a place to stay." The staff member replied, "Don't worry, I have a room all arranged." Marie became calm, ate her dinner, and then went to bed. The next morning, she never mentioned anything about the night before. Reminiscence is another powerful communication tool. It can give people with dementia a sense of competence and confidence through using a skill they still have. By recalling past events with the help of old photographs, newspaper clippings, videos of old films, and other familiar items. Reminiscence doesn't always have to be a conversation. It can also be listening to music or completing an activity. We will be having a Lessons in Dementia workshop presented by Dr. Samantha Day in May that will go more in depth into the power reminiscence has. It is not always easy for an individual with dementia, and as a caregiver or a family member, it may be hard at times to not take things personally. Here are 5 helpful tips provided by the Family Caregiver Alliance to reflect on. We cannot change the person. It's important to maintain a positive attitude. The behavior has a purpose. The behavior is often triggered, and what works today may not work tomorrow. For care providers of those with dementia, it isn't uncommon for the care you are providing to begin to wear on you and to begin feeling burnt out. In addition to the 5 tips we discussed on the previous slide, it is also an important reminder to remember to put on your own oxygen mask before helping others. It is difficult to pour from an empty cup. As the Alzheimer's Services Coordinator for our program, I have spoken with many individuals and families who provide dementia care and are not always aware of the resources out there to help make their lives easier. Over the next couple slides, I will be talking about a few of the top resources in our community that I most often refer individuals and families to. The first is the Humboldt Senior Resource Center, who is committed to providing services, information, education, and recreation for seniors, family members, and caregivers in Humboldt County. I often refer people from my consultations back to HSRC if they are not interested in a day center style of program, they are interested in receiving meals, or looking for additional therapeutic support. In addition to the services you see listed, HSRC also houses the Adult Day Health and Alzheimer's Services, Redwood Coast PACE, and the Multi-Purpose Senior Services Program, which I will be talking about more in the following slides. As Wendy mentioned earlier, Adult Day Health is a therapeutic day program that provides activities and support to adults 18 and older with physical and mental disabilities. But in addition, to direct care provided to participants, Adult Day Health also provides respite and support for family caregivers. Participants of the program benefit from individually tailored care plans, therapeutic recreational activities, seasonal celebrations, socialization, and forming friendships. Cost of program services can be covered by Partnership Health Plan, otherwise known as Medi-Cal, the Veterans Administration, and Redwood Coast Regional Center. Caregiver respite grants and private pay options are also available. Alzheimer's Services offers one-on-one consultations to families, caregivers, and care professionals in person and over the phone, providing support to those who are navigating the journey of Alzheimer's disease and other cognitive impairments. Through these consultations, not only do we provide support, but we also offer free educational materials, handouts, referrals to other community resources, and access to our resource library. In addition to we also offer educational opportunities such as our series Lessons in Dementia and our annual Dementia Care Conference. Redwood Coast PACE, a program of all-inclusive care for the elderly, is a comprehensive health plan for older adults who wish to remain living in their home and community. They provide medical, social, nutritional, rehabilitation, and support services. They serve those who are 55 and older, who need a nursing home level of care, can safely live in the community with no harm to themselves or others. Cost of services provided depends upon your Medicare and Medi-Cal eligibility. The Multi-Purpose Senior Services Program is a community-based care management program who provides an experienced care manager to meet with you and your family to assess your needs and provides long-term help with arranging services you require. To qualify for MSSP, one must be 65 or older, a Medi-Cal recipient, and at risk for skilled nursing placement. These are just a few of the many services MSSP offers as listed. Area 1 Agency on Aging is part of 33 similar agencies in California and serves Humboldt and Del Norte counties. The agency assists older adults and people with disabilities, their families, and caregivers with finding information and resources in our local community. One of the resources I often provide to my consultations are their senior information guides. The guide is a booklet of categorized resources in the community ranging from social services, housing, medical, caregiving, and more. In addition, they have a variety of programs available to the community, such as the ones you see listed. Redwood Caregiver Resource Center offers support and assistance to caregivers of adults with brain impairments through education, research, services, and advocacy. When I receive consultations from family members caring for a loved one with dementia, Redwood Caregiver Resource Center is one of the first recommendations I make due to the support they provide families through support groups, consultations, and the respite grants families can apply for that can help cover the cost of additional respite support in the home or attending an adult day health program, in addition to the other services you see listed. Dementia care cannot be taught strictly through lists of do's and don'ts, and memorizing the best ways to respond to every situation. Empathy is needed for the care receiver to learn ways to deal naturally with situations as they arise. I want to end today with this quote: "It is far more important to know what person the disease has than what disease the person has." And now I'll take questions. Please feel free to unmute yourself or enter any questions in the chat box.
Yeah, I'll go ahead and share something. So it's kind of a timely PowerPoint here. Yesterday, my dad, I kind of watched my dad. He lives alone, but he has dementia, and so sometimes he's just a little bit off, more than other days. For the most part, he's okay, but he's been an angry kind of person just in general, like in the past with his family and his siblings and things. And so when he's angry, I generally just leave. And so he was really excited to go to play with me. And so I just left. And then I called him, and I knew that he would forget why I left, because his memory. And so I told him what happened and why I left. And he had had an accident, and he was like really frustrated. He was frustrated. And then it just made it even worse. And so that's why he was upset. So it's always like kind of this balance of, not being sort of a doormat, but also understanding. Because a lot of times more information will come out, and there's a trigger, like you mentioned, to the anger. So what do you do as far as boundaries go?
For boundaries of when that anger
Yeah.
comes up, try to be patient. And, I know in the moment it can be difficult to not become frustrated yourself. Start looking for what could possibly be triggers and putting that into a conversation, and then trying to resolve those triggers to then proceed.
Yeah.
Had a question.
Okay, go ahead.
So when they ask questions and want help,
Mhm.
and then I give help, they get really frustrated and angry. And this is actually my mom, so it's super frustrating. I don't really know how to handle it because she asks for the help, but then when I start helping her and explaining, she tells me she knows and gets really aggressive. And so I usually just walk away and, remove myself. But I don't know what to do because it's almost every time she asks for help and I try to help, then she's frustrated with the help I'm giving her.
So kind of, and is it in the realms of like care, providing care, personal care?
Um,
Or,
Not so much because she's one of those very stubborn people that's not gonna let me do a lot. I mean, I've already tried to go to the doctors with her because she's forgetting stuff that the doctor tells her,
Mhm.
and she won't allow me to go to the doctors with her at this point. So I don't really know what to do.
Mm,
So it's with things like her phone card, adding her minutes to her cell phone, and she'll ask me how to do it and I'll try to explain it, and then she'll get frustrated and tell me she knows and take it away. And then I end up doing it anyways later.
kind of like providing those spaces where, okay, it's not working in that moment, and if
Just step
possible,
away, come
can
back.
it be visited in at another time? In terms of the difficulty with the doctor, is the doctor still communicative with you?
um
Or-
they don't communicate with me at all and never have. She's always gone by herself, but it's getting to the point where she's forgetting how to get to the doctors, and I'll have to, which doctor is which,
Mhm.
because she's seeing several, and she'll come home and say, "Oh, well, I got a good bill of health, but I have to have this," and but then can't explain what it was or what it's for. So I'm at a loss because she's very, very independent woman.
And that's often where that resistance comes from.
And the stubbornness, she's very stubborn.
Um, providing simple steps sometimes helps if you're able to meet them on that level.
Right. And I think I am on her allowed to get medical information. So the doctors should be allowed to give me that report, correct?
If you have a power of attorney or some sort of approval, yes.
Yeah, well, I think I'm on her, information, they'll release. I
Yeah.
think.
Yeah, you should be able to try to express your concerns with the doctor and
Okay.
see how they're approaching things. Maybe
Yeah. Because they only see her here and there, so they don't really see that in her.
mhm.
Because, she's 5 minutes in and out.
And then
Okay.
so trying to address that.
Awesome.
Um,
Thank you.
One thing I've used, if the doctors are, saying, well, I don't have permission to talk to you, sometimes I just say, okay, you don't need to tell me anything,
But
but
let
please
me
listen to
tell
what
you.
I tell you.
Yes.
Yeah.
Okay, perfect. So at least they'll have a thought when she goes in,
Right.
maybe to
People
write
can-
the information down and the test she has to have, because she's forgetting what tests they've ordered.
Right.
Yeah. I see that there's another question in the chat.
Yeah,
it
I
looks
was
like-
just reading that actually from Lori.
Great.
So Lori said that my father became really frustrated and depressed because of his lack of purpose in life. He'd always been a worker. We never were able to find anything that he was capable of doing, and he and he could see as purposeful. Any suggestions for purposeful activities for men? Is there anything, Lori, that he was interested in or something he did as a profession?
You know, unfortunately, he never developed hobbies. The thing that really stimulated him was his mind. So he read magazines and he talked with a bunch of guys that we call them the Democratic Club, and they solve the world's problems. But, you know, even like I would try to give him a broom in the morning and I'd be like, well, come on, Dad, we're doing our cleanup here. You get to sweep. And he just got really grumpy about it, like he'd do it. But he also realized that that was a really simple activity and it wasn't worthy of him. You know, we thought about like, oh, let's give him the big pile of bolts and nails and ask him to sort them. But he didn't want to do that. I don't know if it was because it frustrated him because he couldn't do it, or again, if he just saw it as make work. It was very hard because he would get really kind of depressed around not being a participating member.
Typically, what we suggest is trying to find any and everything, which it sounds like you're doing, is trying to include him in those little tasks at home as a way of participating. Is he pretty sociable?
He's actually passed away now. He passed away in January. He was sociable, but he had about a 15-minute limit. You know, he was living with my brother, who was kind of a subsistence farmer. So my brother would just take him out in the field with him and give him a chair. And then Dad would sit there while my brother worked for as long as that worked. But although he had some fantasies in his head or delusions, I guess, that, you know, he was a worker on the farm, like he totally forgot that my brother was his son. It really, he didn't, but then he would feel like he wasn't doing work, you know, like everybody else is out there working and I'm sitting in the chair. And because of where they were living, like an adult day center didn't work. I don't think that would have worked for Dad anyway, but there really wasn't anyone near.
We typically suggest trying to find those stimulating activities, such as setting up an exercise class or something that might spark a little interest. Here we offer, with the day program side of things, if we have someone who's pretty agitated or anxious of wanting to go home, and they usually like to work, or it becomes a thing that they think they're at work, we try to get them to assist with folding towels or simple little chore tasks at hand that they want to do if they want to help.
Right.
Thank you, Kaitlyn.
You're welcome.
I see Nancy has a question in the chat. She says, my husband forgets the words he wants to say. If I can't guess them, he gets frustrated. What can I do?
Yeah, my husband has been very talkative and very gregarious, and he really gets frustrated easily when he can't think of words, but I can't seem to figure out what it is.
Would it help to just give him to meet that with silence, to not jump in with the suggestion and to give him just a moment and make that okay?
Sometimes it does. Sometimes it doesn't. And if the silence lasts too long, then sometimes he'll forget what it was he was trying to say, which, yeah.
Sure.
Yeah.
That's hard.
Kind of what Wendy was just saying is meeting them with silence sometimes to try to give them a moment to see if they can collect that thought. And offering maybe a few suggestions. And if that's obviously causing anxiety, possibly trying to offer the redirection of changing the subject for the time and saying, oh, hey, we can circle back to this later if it's appropriate for the situation.
That makes sense.
My mom got really good at talking around the words she wanted. She had a lot of word loss. And I don't know if that's something that he could do. Also, you know, you could prompt him to like, you know, well, what does that thing do? Or, you know, where do we find that thing? Or something that he could then talk around it.
That sounds good. Yes.
Those are good solutions too. Thank you, Lori. Celeste put in the chat box that I often say, take your time. I'm not in a hurry. When someone can't think of a word, to take the pressure off. Or it's okay, you can think of, excuse me, it's okay, can you think of it another way to say it? So they aren't trying for the same word for a long time.
Okay.
Any other questions? All right, I think that will be all for today then. We hope to see you next month for our lessons in dementia with Dr. Michael Fratkin. And please feel free to fill out our survey if you would like to share your thoughts with us. Have a good day, everyone.
Hey, thank you very much.
You're welcome.
Thank you.
Thank you.
Kaitlyn,
Thank you, Kaitlyn.
You're welcome.
not hear me? Kaitlyn?
Yes.
Oh, I did put a question in the chat box. Does these trainings count towards the CEU units for an executive director for an RCFE?
We
No.
currently don't have the CEU set up for our lessons in dementia series yet.
Okay,
But can provide a participant certificate.
that would be great. Perfect, thank you.
You're welcome. All right. Bye, everybody.
Bye.
Bye.